This is The Road Show, and I'm your host, David Warren. More than 1 out of every 6 Americans started therapy for the first time in 2020, and mental health care has become a more common experience for many Americans than previously assumed. The belief that people who go for psychotherapy are weak, mentally ill, or just crazy is a quickly changing misconception about therapy. Nowadays, if you seek treatment, it's viewed as a sign of resourcefulness. This is our subject today. It is therapy, and we welcome back to the airwaves one of my co-hosts on the program, but today she is our guest for the full hour. Her name is Kim Harr. She is a licensed professional counselor and a licensed marriage and family therapist. And Kim, I'm glad for this opportunity to have an entire program to talk about the importance of therapy.
I'm grateful to be here, David. I'm happy to kind of debunk some of the stigmas about therapy and bring some light into the healthiness of it.
I went to high school with today's guest, and I would have never thought that this would be something that you would be interested in as a career. So fast forward many, many years, and I heard that you were studying to become a therapist.
Mm-hmm.
Tell us about that journey.
Well, it's funny. When we went to high school, I actually went to college immediately following high school, and I went to become a school teacher. So I went for 1.5 years to college to become an elementary education school teacher. But because of life situations, finances, I had to drop out. And I went to work for my father. I got married, had children. And when I was actually in my late 30s, I decided to go back to school. And when I went back to school, this is just where my heart was leading me, was to become a therapist. The real reason kind of behind what my heart was leading me is I had gone to several therapists myself. They were marriage counselors at the time, and this is, 25, almost 30 years ago. And I went to several counselors with my husband, and it wasn't great counseling. And I walked away more discouraged than ever. And I decided that I was going to go back to school and I was going to learn to study. I wanted to be a hope giver, and I wanted to be able to give what I hadn't found.
It's interesting that your practice, do we call it a practice for therapists?
It's a private practice.
The name of it is?
There's Hope Counseling. And that was because I wanted to give hope. I wanted to be able to say, hey, we may not see the answers, but we're not going to give up trying.
So lots of questions I have for you today, Kim, and I know you've got great answers for the listening audience, but let's just start with the obvious question. What is therapy?
All right. Therapy is, first of all, it is a safe place where you can go and you can meet with an impartial, I'm going to say a licensed therapist, somebody who's gone through school, they've gotten their master's degree, they've got training in therapy, and it's someone that can meet you with unconditional positive regard. They meet you where you're at, and a lot of times it's a place where you are able to explore your emotions and experiences and sometimes say things you've never been able to say before. It's important to, sometimes I'll be asked, what's the difference? I've got a friend who's just like a therapist, but going to somebody who doesn't know you, you don't have a relationship with, that can speak truth into your life is really important. And sometimes with friends, they may speak into your life, but they're speaking with a bias.
Correct.
And so that's why it's important to go to somebody that's impartial. And what you get in therapy, what is therapy, is you're getting somebody that actually has got expertise in helping you identify where are those stuck points that I'm getting stuck at. What are some tools to help me move forward, to maybe make some changes? What are self-destructive patterns or self-talk I've been feeding myself? And so it's really about how do I move forward? And I like to tell people I'm like their tour guide. It's you come in and you tell me where you're stuck, but also tell me where you want to go. Or where you think you want to go. And I'm going to help get you there.
You mentioned that you have a master's degree in counseling or therapy?
I have a Master of Arts in Marriage and Family Therapy.
Okay, that is classroom hours. What about clinical hours, which in my mind means that you are either shadowing or starting to act as a paratherapist
Right.
with people who are seeking therapy? What kind of clinical hour input did you have?
I'll tell you what mine was, and it differs between different licenses. I have got 2 different licenses. I'm a licensed professional counselor, but I'm also a licensed marriage and family therapist. So I've got 2 different licenses. And with my licensed professional counselor, I did actually 3,000 hours after I graduated from my master's program. And in that master's program, that's where you're learning you're learning the tools, but you really don't learn to be a therapist until you're getting in that therapy room and you are under a clinical supervisor. So it's kind of like a doctor. When you're learning to be a doctor, you go and you're reporting and you're checking your charts and you've got somebody overseeing that. Well, that's the same thing in therapy. Is I would take my cases that I would meet with for the week. I would see people. I would go once a week to my clinical supervisor. He would review that with me. Many times he would tell me in the very beginning, hey, here's what I think you need to be doing. This is the direction. What did you think? And that's where you grow, is in those 3,000 hours. And so it's a period, like for my licensed professional counselor, I ended up where it took, I think it was like 2.5 years after I graduated from my master's program, that you're under supervision between 2 and 2.5 years. And it is you are learning as you go. I am now actually a supervisor for therapists that are coming out of college, and they meet with me on a weekly basis, and I'm able to give back in that same way.
And what is some of the best advice that you give your trainees?
I think some of the best advice is things that I was told, in that one of the most important things when you are the therapist, it's not minimizing the importance of the relationship between the therapist and the person that's coming in, and that unconditional positive regard, and not minimizing, sometimes just being that safe place where someone can actually begin to explore and put out things they've never done before. You may think that that's not important, and sometimes that's the most life-changing.
Now, do you become friends with your therapist and do things on the side like go to dinner or go see a movie?
You do not. And if your therapist does that, I would say find a different therapist.
Why?
Because ethically, that is called a dual relationship. And if I have a dual relationship with you, if you're inviting me to your family functions, I am now actually becoming more of your friend. And so if you're coming in for therapy with me, it changes the whole dynamics. It's not about you, it's about us. And so it's important that when you are looking for a therapist, you're not going to somebody that you work with or you've worked with. You're not going to your, child's friend. You want to go to somebody that has no ties to you.
All right. So, sounds interesting. But how do I know if I, David Warren, need therapy?
I think, when you look at, do I need therapy, are there things that are just kind of ruminating in me? Let's just say one, you can go for things like depression. Okay, am I having changes in my behavior where all of a sudden I don't have energy and I'm sleeping all the time and I'm feeling worthless and I'm feeling down all the time and I can't shake this off? Okay, one, that's the time you go for therapy. If I'm dealing with things like anxiety and anxious thoughts, and if I'm having, heart palpitations and I'm worried about things, okay, that's a good time for therapy. If I'm having issues in my family that are beginning to really irritate me or I don't have the answers, that's a good time for therapy. So I think, and let me also say this, you don't have to have a problem to go to therapy. Sometimes I like to say it's a little bit like when you take your car into the shop for just maintenance. I get my oil changed. I put gas in my car. I've got clients through the years that will say, hey, I just want to come back once a year just to check in with you. Tell me, how do I think I'm doing? How do you think I'm doing? And it's actually just really good maintenance.
Well, and at some point in life, you will need a therapist. And let me just interject here, based on experience, you don't just pick up the phone and find a good therapist who's got space in his or her schedule that same day, that same week, or maybe even that same month.
Especially right now. Right now, you said in the intro that the rates of therapy, people going to therapy, has really increased. And I think right now where we're at, it's really common to call a therapist and you might be waiting 2 to 6 weeks. People are taking waiting lists. They're not accepting new clients. So yeah, it's not just picking up the phone saying, hey, can you get me in today?
Why do you think there is an uptick in interest or just knowing I need a therapist?
Some of that is because therapy is people are talking more about it. I think it used to be the stigma of, oh, you're going to therapy.
Mm-hmm.
And now it's a little bit more of, oh, who's your therapist? And so it's not the hidden embarrassment of somebody's going to a therapist. It's a little bit more normal. But it's also the uptake is, we've gone through a season where we've had a lot of isolation. We've had a lot of pressure. We've had a lot of change in our lives. And so there's just been an upheaval in our nation. And we're having to adjust and there's a lot of life imbalance. And so I think that that's really one of the biggest reasons we're having that uptake.
Well, therapy, as I mentioned in the intro, is short for psychotherapy. Don't be scared by the word psycho. I'm sure it just means mind, correct?
It does.
All right.
It does.
So what is the difference between a psychotherapist, somebody that we just call a therapist, and a psychologist?
Mm-hmm. There is a lot of different degrees out there. Psychologists they can do therapy. They also are a little bit more knowledgeable about the mind medical part of things, a little bit more knowledgeable about the testing of things, whereas a psychologist can do things a therapist can do. But a therapist without that psychologist degree, I can't do things a psychologist would do. So there is a difference. There's also a difference. The 4 main licenses would be, and I'm talking from Oklahoma, it may be a little bit different in the letters, but there's like a licensed alcohol and drug counselor, which is an LADC. There's a licensed clinical social worker, which is an LCSW, a licensed professional counselor, which is an LPC, and a licensed marriage and family therapist, which is an LMFT. And they all have a little bit of a different, strength in their license.
And then what is the difference between a psychotherapist, again, just
Mm-hmm.
a therapist, a psychologist, and then let's add in a psychiatrist?
Right. A psychiatrist is a doctor of the brain. A psychiatrist is who you're going to go to if you are going to be looking into medication. It's more of the chemical part of things. Psychiatrists will come in and they will ask you for a background. Hey, what's going on? Are there changes that have happened recently? And many times somebody will think, hey, I'm doing therapy with my psychiatrist. But a psychiatrist is not a therapist. They're finding out just the details so that they know, do I need to prescribe medication? Do I need to give a diagnosis? What is it that I need to do? And so that's a little bit more like a specialty of the brain. If I go to my regular primary care physician, that's my doctor. A psychiatrist is a doctor of the brain.
Okay, so let's talk about cost. I happen to know that can be very different from therapist to therapist.
Right? And from area to area.
So in other words, you're saying like in a big city like New York,
Mm-hmm.
you will most likely pay more per hour, which
Right.
An hour in a therapist office is 50 minutes.
Right. It's 50 minutes is going to be considered your hour of therapy.
Okay.
Because a lot of times a therapist, in that last 10 minutes, they're charting notes about your therapy session, what they need to, remember for the next time they see you. So you're getting that hour, but it's 50 minutes.
But I have noticed that there's a real difference in cost even within the same city. Now, is that based on it's a more knowledgeable therapist, it's a fancier location? Where does that cost come from?
I would say yes to all of that. I think that there is a part of, cost can be how many years? Am I a beginning therapist or do I have 20 years of experience?
I know.
That's going to be a difference. Am I in a group practice? Am I in an agency setting where I am more in the community? I'm dealing with a different population. Who am I serving? Where am I serving them? And some of that can be, I was telling you earlier, when I set my prices, I look at, okay, what is the average price, the kind of the range in my area, from low end to high end. I compare my experience to other experience. Where would that normal be? And I try to set that where it's not too high, but it's going to be based on my experience and what I need as well.
Okay, so knowing it is going to cost me to see a therapist.
Right.
What if I say, I'll just go see my pastor because that's free?
Right. If you don't have access where I can't afford going to a therapist. Now, I want to say a lot of therapists have a sliding scale, especially if they're like community agencies. They may go down to as low as, $10, $15. They may work with you. But going to a pastor just because they're free is you want to go to somebody that's got knowledge in the area you're needing counsel in. If I mentioned earlier about depression. If I am in clinical depression, I want to be going to somebody that can give me depression scales, that can monitor this, that can give me coping skills. And depression counseling typically is not just a 4 to 5 session counseling. It is more of an ongoing counseling that we're going to be giving tools and creating some new patterns, but you want somebody that's very knowledgeable in what you need. Pastors are, and I don't know if we want to jump ahead to that part of it, but pastors typically have got training in counseling, but they don't have the same level of training, the extensive training as a licensed therapist. There are pastors that are licensed therapists. So you just want to kind of ask your pastor, are you comfortable with this? What's your training? What's your background? Do you do this? So that you're knowledgeable in making that decision.
Excellent advice from Kim Har, a licensed professional counselor and a licensed professional marriage and family therapist with There's Hope Counseling. And we're going to take a break and be back with more. And I, David Warren, want to ask Kim, how do I find a good therapist? Where do I look? And how do I know if he or she is good at what he or she does? I'll ask those questions after this. I'm David Warren, here with some exciting news for Oasis listeners. We have a new mobile device app. It's free, easy to download, and lets you enjoy our refreshing music and talk everywhere you go. If you have an Android cell phone, go to the Google Play Store. And if you have an iPhone or iPad, visit the Apple Store and search for Oasis Radio Network. Be an Oasis ambassador and share this news with family and friends around the world. Oasis Network. On today's program, Kim Har is here, a licensed professional counselor and a licensed marriage and family therapist, or if you put the letters there instead, Kim, what is it?
LPC and LMFT.
And that only took 3,000 hours plus the classroom, right?
That's right.
Training. Well, I'm David Warren, your host, and I love this subject, and I love my guest today because she co-hosts with me from time to time, but she is my and our guest for the entire hour on The Road Show today. So we are talking about therapy, and now I want to talk about finding a good fit. Where do I find him or her? Now, I will go ahead and go on the record here. I, David Warren, have had 3 therapists in my history so far. And I have seen a male therapist, and I have seen a female therapist. Well, 2 female therapists, thus the 3. And my personal favorite was a female. And she was in her 70s. And she, like you, she's now retired, but she trained upcoming therapists. Mm-hmm. And I needed somebody who could handle an A-type personality, who can think quickly on his feet and recognize when I'm kind of selling her a bill of goods. And she, quote, calls me on my stuff. So do you think I've presented that pretty fairly?
I think you presented it fairly. I think it's a good question. And how do you find a good therapist? Because there are some I'll say the basic things that you want to look for first, which one is you want to look for a therapist that is knowledgeable and has experience in the area of expertise that you need. What I mean by that is, what am I needing counseling for? If I'm going through grief work and I'm needing to work with somebody to process just loss and grief, I'm not going to seek out a child therapist if I'm an adult and I don't have a child, but I want to go to somebody that's got experience in grief and loss work. If I'm dealing with something like post-traumatic stress disorder, I've had trauma, I want to go to somebody that's trauma informed. If I am, going through empty nest and I'm going through just transitions in life, or I've got a new job, I want to be going to somebody that says, hey, this is what I work with. If I have kids, it's really important to get a good therapist that works with children. That I always suggest going to a registered play therapist for children, because it's somebody that has put a lot of hours into skills of how do I learn to do therapy with kids. So the first thing is, go to somebody that's got expertise in what you specifically are looking for. There are a couple different ways you can find good therapists. One is you can go to, where you can find therapists even in general, you can go to some online directories. There are two that I actually really recommend. The first one is called psychologytoday.com. And you can go in there and it will say search for a therapist in your area. You can put in your zip code, and then you can do a bunch of filtering. I can filter, do they take my insurance? Do I want a man? Do I want a woman? Do I want a Christian counselor? Do I want somebody that deals, specifically with my issue? And so you can actually put a lot of filters, and it will give you a long list of therapists where you'll see the therapist's picture, a brief bio, and usually there's a link to a website. And I suggest you go to the website, try several of them, look at different websites, I know on my website, I have a video of myself on my website because I want people to kind of get a feel of my mannerisms. Mm-hmm. So go to websites. So that's going to be one. Focusonthefamily.com is another. There are only Christian therapists that they refer. I'm one of their referral lists, but I'll tell you, for me to become a referral that they used, I had to fill out it may have been a 10-page paper that said, what do I believe? Why do I believe it? How do I approach different things? And so the therapists from Focus on the Family are going to be really well vetted.
I know that I would feel more and do feel more comfortable with a therapist who is a Christian, mm-hmm. because that person will at least respect what I believe.
Well, and I have had a lot of people that have come to me and they may say, are you a Christian therapist? And I tend to say I'm a therapist that happens to be a Christian. And I will ethically, I want to honor your faith when you bring it into session with me. Now, Personally, I like a Christian therapist because that's my background, and I want somebody that's familiar with my background as far as beliefs. But you can go to a non-Christian therapist. That can be great, and they can still allow your faith to come into the session. So if you go to a Christian therapist, you just want to make sure that it's somebody that's respecting your beliefs, that is not putting their beliefs on you. That may be a good place for you to go to your pastor. If it's something that's of a spiritual nature and you're struggling with a spiritual belief, hey, can God forgive me for this? It may be somewhere where you start with your pastor because it's somebody that's got the same spiritual beliefs, and then go to a licensed therapist.
But if I have drug or alcohol addiction issues, I probably need to see somebody who's licensed in that field.
You absolutely should go to I would say a licensed alcohol and drug counselor, because that's their specialty. A licensed alcohol and drug counselor will deal with things like, how do we create relapse prevention plans? What are our triggers? That is their specialty. And so you want to go to the specialty. When you're looking for a good therapist, you want to be looking to somebody that shows empathy, that has got knowledge in the area. You can ask them, hey, what's your training? Somebody that is, able to talk to, and it feels like it's just really easy for me to be able to put my stuff out there. So it's not somebody that does all the talking. It's somebody that actually brings that out of you and gets you processing your stuff.
What percentage of talking should be the person who's receiving therapy and the therapist?
I think that kind of differs from situation to situation because it depends on the person. If I have somebody that comes into my office and it's their first time in and they're nervous and I may have to do more of the talking initially to draw that out of them. But a therapist shouldn't be the one that's doing all of the talking.
Not giving personal anecdotes.
Not giving personal anecdotes, not saying, hey, let me tell you about my life. Because that'll make you feel better. It needs to be, I am dealing with my client's issues. So they shouldn't be doing all the talking. I also suggest one of the things when you're looking for a therapist, because you're not going to know if it's a good fit right away. It's a little bit like when you go visit a church. Okay, you don't know walking in the doors. I haven't heard the pastor preach. I haven't heard the song leader. I haven't heard all of this. So some of it is you're going to go into that and there will be some unknowns. You're going to be looking at what feels like a good fit personality-wise. Mm-hmm. Is this person easy to talk to? Did I get a good feeling, just in that session with them? But that's going to be a relationship that develops over time.
It's kind of a side note here that I'm giving, but I remember the first therapist that I saw, and I didn't know any other way to interact with a therapist. So I thought, well, this is what all therapists are like or what all therapists do. But at one point during the therapy session, she said, sometime we should just do this over dinner. And it just felt funny to me. I mean, it wasn't an advance in any way, but it was like kind of two birds, one stone suggestion. But it's
not professional.
So what I did, Kim, was I went online and I typed in signs of a bad therapist.
Yeah.
And I realized very quickly by spotting in the list that this is a no-no.
Right. There are people that have come to my office over the years, and I may have thought, gosh, if I would have met this person outside of my office, this is somebody I would have actually thought we'd be good friends. But we cannot be friends because they are my client. I am their therapist. And it's like, you know what? That's not okay. So you have to be careful. Sometimes I have to remind maybe a little bit more of my teenage clients. I have to remind them I'm not their friend, I'm their therapist. But one other thing you can do, a lot of therapists will offer a free 20-minute consult or a 15-minute consult.
On the phone.
On the phone. Well, and sometimes I have actually even done that in person. I've said, hey, if you want to stop by my office and you want to meet me and we can kind of discuss things for, 15, 20 minutes. However, in that consultation, it's not about, we're not doing 20 minutes of therapy. We're not doing, you're giving me your life history and you're talking for 20 minutes and now you're asking me, now what do I do? That 20-minute consult is more, you give me, hey, what's the broad umbrella? What are you looking for? And I'll tell you, hey, this is my approach. This is how I come at this, and this is how I think I could help you. So it is not a therapy session.
Or I know somebody who would be excellent in this area to help you.
Yes. Many times I will give, and just in this last month, I send out more referrals saying, you know what? I could do this, but I know somebody that actually that's their expertise, and I think they'd be a better fit.
I'm looking at some of the notes that you provided for me in advance, although we have needed very few notes on today's program because we're both very passionate about this subject. Of course, Kim is our licensed professional counselor and our licensed marriage and family therapist on the program today, and I'm just an interested host here. But you have some bullets here on signs of a bad therapist, and just to have a little fun side trip here, I again knew this was probably not a good idea to go to dinner with my therapist. It just felt funny, and after doing a Google search, I realized that is not.
It's not a good sign.
It's not a good sign. And that's when I went to somebody else.
Yeah, which is wise. Really listen to your intuitive nature too. When you feel like this doesn't feel right, listen to that. So some of the signs of maybe a therapist that's not going to be a good therapist, otherwise known as a bad therapist, would be somebody that talks excessively about themselves or somebody that just discloses too much personal information. You don't need to know about my life. You don't need to know about everything about me because this isn't about me. We need to reserve this time for you. So that's one of the things is, if somebody's just talking to you about them, trying to buddy with you, not a good therapist. If you've got a therapist that can't accept constructive criticism, and what I mean by that is if a therapist gets offended at something you say, like, let's say you're coming to therapy with me and let's say I said something and it just rubbed you the wrong way. Maybe you thought that I was callous or I brushed something off. And the next session you try to tell me that kind of offended me. If I can't receive that, if I can't manage my own emotions, that's going to be a sign of a bad therapist.
What should you say? If I say to you, when you said this, I don't know that you meant to hurt my feelings or rub me the wrong way, but it really did.
Right.
So I don't really want to do that again in our sessions.
I think a good therapist would first of all appreciate, thank you for feeling comfortable enough for telling me that. Because I know that took a lot of courage to tell me that. So it may be a repair saying you're right. I didn't intend to do that, but I hear it did offend you. So, hey, I'm asking, would you forgive me? Would you let me do a do-over on that? Could I say it a different way? Or it may be, this is what I was meaning, and let's have a conversation about that. Because what we're doing in therapy is kind of like the training wheels. I'm trying to help you have successful relationships. And if you can't have a successful relationship with me, then how am I preparing you and helping you to have a successful relationship outside of this office? I think another one is if you've got a therapist that appears bored or distracted or not listening to you. All right. If they're not giving you eye contact, maybe not be the therapist for you. And then if you've got somebody that treats you like you're inferior, like I'm the one that's all knowledgeable and I use that as a power differential. If I make you feel less than, that's not going to be effective therapy.
Kim, before we take a break, I know that there are different types of therapy out there. So different approaches, or I don't know what I'm trying to say here, but categories of therapy?
Yep, kind of modes of therapy.
Okay.
And some of those are going to be things like individual therapy when I just go in just for me. It may be couples therapy or marriage counseling. It's going to be me and my spouse, me and my partner. It may be premarital counseling. It may be family therapy. And that doesn't just mean husband, wife, and kids. It may be me and my sibling. Or it might be, gosh, I'm really dealing with some issues from my past with my parent, and can I bring my parent in with me, even if they're older? So family therapy is a number of different things. You can do group therapy, which that tends to be a little bit more cost effective because it may be a group, especially like when you're dealing with things of like addiction natures. Sometimes they will offer, hey, we also have a group of clients that it's a closed group. It may be a group of women that deal with self-esteem, or so group therapy is less expensive. And then now in the last 2 years, virtual therapy has become very popular where you don't even have to leave your house. You can actually do online teletherapy.
Do you feel that's effective?
Yes, I think it is effective. It doesn't mean it's everybody's preference. I have clients that started out with me in person and we've moved to virtual because kids are out of school or for whatever reason, maybe they moved in my same state. So I'm still licensed to see them, but it's not as convenient for them to come in. I think it can be effective. My personal preference, I still prefer that in person because it allows you to actually come into my office in that safe space and you're leaving. You're not in your office. You're not in your home. But they can both be very effective.
Earlier, you gave 2 websites where people can find licensed therapists. Would you give those again, please?
Yes. Psychologytoday.com. And there's a little box up there that says find a therapist, put in your zip code. You can put in your filters for what you're looking for. And then also focusonthefamily.com. And you have to hunt around a little bit there, but it says like Christian Counselors Referral Network, and they will have a list of therapists in your area.
Before we do go to break, what is your thought on female only having female patients? Because as I mentioned earlier, my favorite therapist was a 70-something-year-old woman.
Right. I think it's dependent on the client because, like you said, you did better with a 70-year-old woman that could speak to your issues. I work with a lot of men, I work with women, and sometimes it's what is it that they're coming in for? Because if you've had someone that's had a negative relationship with the opposite sex or with the same sex, they may feel more comfortable going to the opposite sex. So it's a little bit more of what do you feel comfortable with, and there's really not a right or wrong.
Good answer. Great information from Kim Har. Her website, by the way, is there'shopehere.com. There'shopehere.com. I am David Warren, enjoying the conversation as your host on today's Roadshow. When we come back, I want to kind of go through a virtual or radio therapy session, so to speak, and kind of you walk us through what those 50 minutes look like. Okay, Kim?
Sounds good.
Back after this.
The Roadshow is a listener favorite, which airs each weekday here on the Oasis Radio Network, starting at 1 p.m. Eastern, 12 noon Central. The Roadshow also has a great section on our website, oasisnetwork.org. There you'll find audio archives of select past interviews, plus guest lineup, and contact information and links to our Roadshow sponsors and its hosts. So join us for the Roadshow, whether on your radio or on your computer at oasisnetwork.org.
We're talking therapy on today's program. I am David Warren, your host, and our guest today is one of my co-hosts, one of my favorite people, by the way, and she can't be my therapist because she is one of my favorite people. Is that right, Kim?
That's correct.
Kim Har, licensed professional counselor and licensed marriage and family therapist. And that's such a catch-22 because we have such a good connection on the air, but you just don't go to a friend for therapy.
You do not go to it. But I love that personally because I will have my friends reach out to me and they may say, hey, I just need some advice. And I will tell them I'm going to talk to you as a friend because as a friend, I'm going to give you my personal opinions. I'm going to tell you what to do and I'm going to get to just be your friend. I'm not your therapist.
So a good therapist keeps his or her own personal biases, opinions out of it.
Yes, they do.
How do they train you to do that?
I think that that's a lot of practice. I think it is also, it is ingrained in us that therapy is not about us. And in that therapy room, I see my client. So I have clients that come in and honestly, I've had clients that have come to see me that I don't agree with moral issues they're making, or I may see something different personally, and I edit out my thoughts with that. And it is more, okay, what is my client coming to me for? Because they're not coming for my approval. That's important for me as a therapist, is I don't want my client afraid, gosh, what is Kim going to say? I want her to be proud of me. Sometimes I will have a client that will say, I thought of something you said this week and you'd be proud of me. And I try to reframe that and say, you know what, it sounds like you were really proud of yourself. Because you don't want it to be where they're seeking the therapist's approval.
Because they will start to filter.
Right.
Something I told, it's my barber. Nobody knows who he is, so I can just say my barber. But I could tell, because we're pretty close, and I could tell that it was probably coming soon that he would say, I'm looking for a therapist. And he had never done it before. And I said, well, one of the best pieces of advice that I could give to you is you as the patient, don't filter. You should be comfortable to say everything that is going through your head, every closed door that you've tucked away for years that's been eating at you. Because a good therapist will help you through that.
That's right.
And don't be embarrassed about what he or she, the therapist, will think of you for saying that or admitting that.
Right. And it's not just what you have thought and everything you've dealt with. It's what are those feelings that you haven't let yourself feel? Many times a client will come in and maybe start to cry and they'll want to apologize. I'm sorry, I'm crying. And one of the first things is, you know what? This is a safe place and tears are welcome here. It's here's some Kleenex if you want it. If you don't want it, that's okay too. But it's really making it that place where you can lay everything out.
And I told my barber, your therapist is not even allowed to share your secrets.
No, everything and that's another reason to have a licensed professional counselor or a licensed therapist, is everything that I am told is completely confidential.
Or you lose your license.
I get written up and I could lose my license, yes.
Okay.
Confidentiality, one of the things is everything is confidential, although there are 4 reasons why I am required to break confidentiality. And your therapist should actually do that in your first session. Go over those things with you so you know what is not confidential.
I'm going to guess one is if I'm talking about harming myself.
Yes, if you are talking about harming yourself.
Harming someone else.
Yes.
And I don't know the other 2.
If I disclose child abuse. If I disclose that I'm aware that there's a child somewhere that's being abused, we are actually all mandated reporters just as human beings, but licensed therapists, again, that comes against our license. If I'm not reporting something, I can legally get in trouble. I can lose my license. So reporting child abuse or elder abuse, if you disclose elder abuse, because again, that's a population that maybe can't protect themselves and are more vulnerable. And so those 4 things are not confidential. Everything that my clients tell me is confidential, and I cannot release any of that information without their written consent, their written release of confidentiality.
Let's talk about a session.
Okay.
Maybe my first session. You mentioned earlier that an hour really equals 50 minutes.
Mm-hmm.
Will I be bumping into people and feel embarrassed that people in the waiting room know that I'm there?
I think that depends on each situation, where you're going. I can tell you from my practice, I've got a big waiting room in the front where people will come in. They will wait for me to come and get them. When they leave, I have a back door that I let my clients go out of. So my clients that are coming and my clients that are leaving never pass each other. A lot of therapists don't have that ability, so you may be going in and out of the same door. But if there's something that makes you feel uncomfortable, or if you know somebody, let's say you're leaving a waiting room, especially in a smaller community, and you catch the eye of somebody and it makes you feel uncomfortable, you can let your therapist know, you know what, I saw somebody in the lobby that I knew. I prefer being booked, at a different time if they're both the one therapist client.
By the way, I will let you know that are listening, if you see your therapist at the grocery store or at a restaurant, your therapist will not come over to your table where you're seated with your family or friends.
Or they should not. That would be a sign of a bad therapist.
There you go.
No, if I see somebody in the store, and I tell my clients this too, right from the very beginning, if I see you in public outside of this office, please do not think I am rude, but I will not wave at you. I won't come talk to you. Now, if you come to me and if you initiate a conversation, then you are giving that consent that, okay, I can't control who knows, me, who knows you. Somebody may ask you, who was that? But no, I will not approach people in public.
Okay, so back to my first session, let's say with you, Kim Har. Will there be anybody else in the room?
Typically, no. I mean, I want to say generally no. If I am training a new therapist, there might be somebody that's under supervision, but that would be getting permission ahead of time. That would be me explaining to you. There will be somebody else. It's a training therapist. But if you say you're uncomfortable, I should be willing to have that therapist leave. So typically it is just you and the therapist that you've made an appointment to go see.
Okay, will I lie down on a couch or will I sit in a chair?
You will typically sit in a chair. Now, at my office, I've got a chair, a couch, and a love seat. And I laugh because it depends what you want to do. I have got some teenage clients that it's funny how familiar they are. They will come in and they may put their feet up on the couch, and I never tell somebody, come lie down. So you're going to do what you feel comfortable with, but typically that will be sitting in a chair or on a couch.
Okay, so I will be doing more of the talking during the initial session because you need to be taking in why I am there.
Right.
And what's bothering me.
Right. Well, and it's normal. I want to say this. It is normal when you make your first session, it is normal to feel nervous. It is normal to feel uncomfortable when you're going to that initial meeting, especially if you've never been to therapy before. This is just kind of weird. So have that in your mind that this is going to be different. But your first session is going to be more of an information gathering session. When somebody comes to me, I'm going to ask them for background. I like to explain it like we're putting a puzzle together. And that first session is like we're just getting the outline of the puzzle. Mm-hmm. I know there's so much more that we're going to go into in sessions, but today I'm just getting the outline of the puzzle. And so with that outline is that expectation of when I go for that first session, I'm not going to leave feeling like, oh my gosh, my world has changed and I have all my answers. It is more, okay, I've begun this process. I've made that introduction. It's kind of this feeling of how is this a good fit? We're getting the information gathering, and we're coming up with treatment goals. So those are the things for the first therapy session.
So treatment goals, would that also include how often I will be seeing you?
It will, and that is a mutually agreed upon between you and your therapist. It is more, when you go to therapy, it helps for you to know what is it that I'm wanting to work on? What's the goal I'm going towards? What would be different if I told somebody this was the best decision? What's the direction I want to go? How often is feasible? And that's different for everybody because, like you said, therapy can get expensive. So I've got clients that come in that say, I want to come weekly. I've got clients that say, I want to do biweekly. Some clients have said, you know what, I can only afford once every 3 weeks. So it's what can you do and have that come up with a plan with you and your therapist. Okay, so if I can't come as often, maybe your therapist can give you some things to work on in between.
So let's say I sign up to see you. I'm not your friend in this case, right? And you become my therapist, and I'm seeing you because I'm grieving the loss of a loved one. Mm-hmm. And let's say I've really made progress. We're 8 months now down the road. I'm seeing you monthly, and I feel like I'm pretty good now. Can I just put my therapy on hold?
Mm-hmm. And, sure can.
And then you're there in the future should I need you for something else?
Absolutely.
And you being a professional, you won't come back at me and say, no, you have to keep seeing me on a regular basis.
No, if you've got somebody that tells you, you have to keep seeing me, then look for a different therapist. Because it is not about the therapist, it is about you. Now, I will say there are times like if I have a couple that comes to see me and it's a crisis marriage or somebody that's dealing with some crisis information, and I know coming once a month isn't going to do it. Mm-hmm. I may say, you know what, I just don't think I'll be a good fit because for us to have change, I think initially we need to see each other once a week or once every 2 weeks. And if you can't do that, that's okay. But then let's refer you to a different resource. So this is something that you're going to work out in agreement with your therapist. What is feasible? Does that work for both of you?
All right. The websites that Kim has given so far today to find a therapist in your area, wherever you're listening across the country, psychologytoday.com or focusonthefamily.com. You're actually part of their roster, and you have your own website if somebody just wants to reach out to you and say thank you for today's program. There's Hope Counseling, and your website is there'shopehere.com. There'shopehere.com to reach Kim Har, licensed professional counselor and licensed marriage and family therapist. Well, we only have a few minutes remaining on today's program, so David Warren here has some questions that he wants to ask our therapist today.
I'm in the hot seat.
Right after this. I'm David Warren, Program Director at Oasis Radio Network and one of the hosts of this podcast. All of our hosts enjoy hearing from you, our listening family, so drop us a note. Our email address is roadshow@oasisnetwork.org. Be sure to subscribe to the podcast and you'll receive new episodes on your mobile devices. And now, back to the show. I'm David Warren, and I am your host today, and I have been program director here at Oasis Radio Network for 35 years, and my guest today has been Kim Har, licensed professional counselor and licensed marriage and family therapist. And sometimes she wears a Roadshow co-host hat, but today she's wearing the hat of a very fine guest. And Kim, I have never said this in my 35 years. You have no clue what I'm going to say, do you?
No, I have no clue.
If I were not called to the radio ministry of Oasis Radio Network, I think I would have enjoyed doing what you do.
I think you're right. I think you would have been a great therapist.
Thank you. Okay, so I have a few questions before we say goodbye. These are my own questions. Let's say I have a friend or a family member, and I think, because I'm a big fan of therapy, that he or she could use therapy. How do I let him or her know of my feelings about that?
Well, you said if it's a friend or family. So that's somebody that you will have earned the right to speak into their lives. You've got a relationship with them. And so I would say you would know a little bit more of, okay, what do you think their reaction is going to be? And it may be in your case saying, you know what, here's something that I've gone through and I made the decision to go to therapy and I just wanted to throw it out there. Have you thought about that? It was something that was really helpful. So it's not in a judgmental way. It's more in you're coming from a helpful way. I say that because you said it would be a friend or family. If it's somebody that you don't have a good relationship with or you haven't earned that right, sometimes just because you see somebody with an issue, that's not your place.
Like,
to go
for example,
and say,
a coworker. I'm sure it depends on how closely I've worked with him or her.
right?
But it may be very inappropriate for me to suggest that.
Well, if you go and say, hey, have you thought about therapy? You seem to be getting angry a lot. Okay, that's not going to be real appropriate. Let's say you work with somebody and they're coming to you and they're saying, boy, I'm really struggling with my kids right now or my wife. Our marriage is just not doing well. Because sometimes people will share something like that.
Mm-hmm.
An appropriate response may be, you know what, here's something that was helpful for me. You might think about this. Would you like me to share my number, or not your number, but a therapist's number with them? So I think it's really looking at what's that relationship you have with that person and being able to come from a non-judgmental place, but come from a, you know what, I've gone through stuff too, and this was helpful for me. So let me just suggest this.
Okay, say I know somebody who is starting therapy. How can I be the best friend or family member to support him or her, not as a therapist, but as a family member or friend?
I think one of the things you can do is if they're just starting and they're nervous and scared, it may be something like, you know what, would you like me to just go with you and sit in the waiting room with you if you just need that moral support? It may be you validating them and saying, you know what, I know it takes a lot of courage to go, and I really admire that you did that. So somebody that's going, you're not going to be just giving unsolicited advice, but you're going to be validating and actually giving that moral support.
I know that in the case of my barber, who has seen a therapist, I think at least a couple of times, he brought it up, I just don't know about this guy, meaning his male therapist.
Right.
And I said, if you don't feel it's a good fit, don't give up on therapy.
Right.
I mentioned earlier, my first therapist was my least favorite of the three that I've had.
Yep. And I think just even doing that, but you mentioned he brought it up to you. And so when somebody opens that door, you being able to say, you know what, in your instance, you said you've gone through 3 different therapists. So you could actually go in there and say, you know what, that kind of happened to me too. But I'm glad I didn't give up. This was something that was helpful. I'd encourage you not to give up.
All right. A question before we go. Let's say that I want to see a therapist for help with my marriage, but my spouse does not want to go to therapy. What should I do?
I think that there's a couple answers to that. One of them is you can't make somebody go to therapy that doesn't want to go. So you can actually go to therapy yourself And your response, you may be learning coping skills with how can you respond to your spouse? Where are those boundaries you need to set with your spouse? But one person changing in a relationship is going to change a relationship. It doesn't mean it will always change it where the relationship gets better and stronger. It's kind of like the Surgeon General. If you're getting healthier and it's an unhealthy relationship, it can actually cause more friction because the unhealthy person doesn't like you setting boundaries or they don't like that. But I would say ask, hey, would you be willing to go with me? And if that comes back with a rebuttal, no, I don't want to, I would encourage you to go yourself, and that partner may see changes in you and they may want to join you.
Well, this I know from experience. Anybody who has had or has a good therapist believes in the power of therapy.
Absolutely. Absolutely. And I've mentioned to you that throughout the years, even as a therapist, I have gone to a therapist because that's my profession. If I didn't think there was value in that, I would be a hypocrite to say, hey, you need therapy, but I don't. Mm-hmm. And so really knowing at different times in your life, when is this going to be helpful? And it can be for times and seasons. I do want to make sure the listeners know in marriage counseling, because you asked about if my spouse doesn't want to go, in marriage counseling, if you are in a domestically violent relationship or an emotionally abusive relationship, any form of a power and control, that is not the time to go to marriage counseling. That is the time for both of you guys to engage in individual counseling, where if one person's being domestically abused, you need to go get specific counseling, and a batterer needs to go to a different program. So the ultimate goal is restoration, but if that's not possible, we want health.
To reach out to today's guest, Kim Harr, her website is there'shopehere.com, there'shopehere.com, or you can visit the websites psychologytoday.com or focusonthefamily.com to find a therapist in your area. Thank you so much for your time, my friend.
I loved being here, David.
All right, Kim Harr, thanks for being with us. I'm David Warren, and it's been
another great Roadshow.
You've been listening to The Roadshow. If you'd like to write to us, here's our address. The Roadshow, P.O. Box 1924, Tulsa, Oklahoma, 74101. Our email address is roadshow@oasisnetwork.org. The views of today's guest aren't necessarily those of this station, but we do appreciate and thank our guest for spending this time with us. The Roadshow, an Oasis Network presentation.